Hello, I'm Rico Cavella, and this is your Ageless Body Self-Care Guide, Operations Manual for your body and for your mind. And the title of today's session is all about heart health. And our expert for this session, he helps motivated people tune up their brain, their heart, and sexual performance. Now, what could be better than that? So this is going to be a really important and really beneficial session. So our expert today is Dr. Stephen Masley. He is a physician, a nutritionist, a trained chef, author, and the creator of the #1 heart health program for public television, 30 Days to a Younger Heart. So I want to welcome Dr. Stephen Masley.
Delighted to be with you.
Thank you, Steve. I really appreciate you coming here and sharing your knowledge and wisdom with us. So let's just jump right in, and we hear so much about heart disease, but I wonder if some people, aren't really aware of really what heart disease is all about and what are all the different, parts of it. So can you give us a little definition of what heart disease is, and also, why is cardiovascular disease still the #1 killer of Americans?
Well, heart disease, the #1 cause of heart disease is that we're blocking the artery, the circulation to our heart. And that can manifest itself in several ways. You could have a gradual buildup of plaque and blocking artery flow. You might get angina, shortness of breath, or chest pressure, or symptoms like that when you are active. But unfortunately, way too often, the first symptom, the first sign of heart disease is you have a heart attack or you're dead. It's sudden. And that's part of the reason it's so common today. I mean, as you said, it is the #1 cause for death in men and in women. I mean, so the #1, we can prevent 90% of heart disease with lifestyle, making the right choices. Yet the problem is, the reason it's still the #1 cause is we spend 90% of the money treating heart disease on procedures and hospital care, really end stage. We're not trying to prevent it. We're doing heroic last minute things that are almost too late oftentimes. So my goal is to help people prevent heart disease, to feel fantastic, to rejuvenate their lives. And I think you can do that with just lifestyle.
Well, I really appreciate that, and that's exactly why I wanted to have you as our heart health, because that's really what I believe in. I think that's what's really important for people to learn, how they can prevent heart disease with lifestyle, and also can heal. Sometimes when you have a heart problem, just with lifestyle, you can heal your heart, right?
Absolutely. You can shrink your artery plaque and make your arteries younger.
Yeah, well, we definitely want to talk about some ways to do that. Also, I wanted to ask you, I know that maybe you've already said that, how you view the issue of heart disease differently from a lot of fellow physicians.
Well, most of my colleagues, I lecture quite a bit at medical meetings, and I've spoken to over 30,000 physicians in just the last 10, 15 years. But most of my colleagues who are out there treating patients, they think of heart disease in terms of risk factor and treating those risk factors like cholesterol and blood pressure and diabetes. So they're trying to diagnose high cholesterol, high blood sugar, and put people on medications. And I'm not anti-medications, but my goal is you don't need the medication. If you actually identify the root cause and you take the right steps, you can prevent and reverse heart disease most of the time without medication. So that's a very different approach to people who are focused on surgery and invasive procedure and drugs.
Thank you so much for that. Yeah, that's the message that we want to get out to people. So talk about what are some of well, again, I think probably most people know that when your arteries get plugged up, that's what's causing the most different, forms of heart disease. But what are some of the really main causes of heart disease?
Well, a myth is it's cholesterol, and that's not true. Cholesterol is not the #1 cause. And we actually have measured thousands of people's arteries and their blood vessels in our clinic and looked at and done compared with fitness and nutrients and food and laboratory measures like cholesterol and blood sugar. And blood sugar is really the #1 cause for heart disease. It's also the #1 cause for memory loss. So, if we could control elevated blood sugar long before you ever get diabetes, that's the most important thing we can do. And there's a lot we can do with lifestyle. Cholesterol has a little impact, but really it's less than we think. Inflammation is a big marker that impacts it. Your blood pressure, we look at that, but I see blood pressure as an indication of the function of your arteries. If your blood pressure is high, that means your arteries are stressed and they're growing plaque and they're constricting, and it makes the pressure go up. We want your arteries to dilate and increase flow and enhance your circulation, which brings normal blood pressure, preferably without needing medication. Again, I'm okay with some medications to be used, but my goal is that you shouldn't need them. And really, the main causes for heart disease are lifestyle. It's that we're stressed, we don't get enough exercise, we eat the wrong food, we don't meet our nutrient needs. Those are the big drivers that cause heart disease, and we can easily prevent and reverse all of them.
Yeah, I think stress is really a big one. You're probably familiar with this. I just wanted to mention it. I just thought of it. But way back in the 80s, I remember reading a paper about how this cardiologist in Boston, he had a cardiac ward, over 100 patients, and he just got the idea to go up and ask them, why do you think you had a heart attack? And he said 90% of them started talking some emotional thing. Their heart was actually literally attacked. You know, their family was coming apart, they had all this stress. So talk about that a little bit. So I think stress, your heart can literally be attacked.
Well, I mean, when you think about that big earthquake back in California that happened several years ago, the rate of heart attacks that day went up 500% in that area. So suddenly, you know, they have a big shake you up, literally shake you up with an earthquake, 500% increase occurrence of heart attacks. So stress is a real factor. We know that. When you're stressed out, and I like some stress, you know, like for you to be doing all of these interviews and bringing all these people together, that's stressful, but we call that eustress. That's like stress that you're you know, it's giving you challenge and purpose. Nothing wrong with that. The bad stress is the everyday chronic stress that we don't manage. So the key is managing our stress. It's not avoiding all stress. I actually like people to have stress in their lives for that purpose and joy and feel great from accomplishing something. But if you don't learn how to get calm, it's a huge risk for developing plaque, and your blood sugar levels go up when you're stressed, and your cortisol goes up, and cortisol shrinks your brain and promotes plaque growth. All the wrong things happen when you're chronically stressed. So my goal, at least for my clinic, is teach people how to manage it. And one of the tests I use is with heart math. We actually have them put on something that monitors their heart rate and looks at it and helps determine, are they calm? Are they a little agitated, or are they just, you know, full out, you know, really agitated? And, you know, I'm trying to teach people, how do you get calm and keep yourself in a state of calm through the day? And it's a pretty cool tool, easy to use. And it, you know, gives you like a score of green, yellow, or red. I mean, pretty darn clear. You want to be green. And, you know, you want to be in a calm, relaxed state. And I think it gives a great deal to help people assess, measure, and learn to manage your stress on a day-to-day basis. So that's kind of one of my favorite tools.
That's so good. You know, that always reminds me of one of my favorite sayings is about worry. You know, a good definition of worrying is visualizing what you don't want to happen, you know. So it's just so silly to allow yourself to be so worried and so stressed out over something that probably won't even happen, right?
Better to be grateful for the good things that are happening and to focus on those.
Yeah, focus on what you want, not what you don't want to happen in your life, right? Well, let's go ahead and talk about some of the ways that you can help people to not only prevent but also reverse some things of heart disease.
Well, I think the pillars are food, eating the right food, avoiding toxic food, nutrients, meeting your nutrient needs. You know, we actually looked at food and nutrients and fitness. Being active and fit is really important. Stress management. I mean, those are the 4 pillars, and I think they're all equally important. So, I mean, whichever those you want to tackle first, like what do you want to jump on first? We've already talked a little bit about stress.
Yeah. Yeah, we'll talk let's go in depth just a little bit more on all of one thing. I do want to ask you one question, because someone I know I think from ultrasound, found out that the carotid artery was almost 50% impacted. And so I wanted to ask you what you think, what naturally thing you could do for that. And you know, the thing called EDTA, like chelation, do you think those things are really helpful or what?
Well, so good question. So my favorite way of measuring plaque is with ultrasound. In the hospital, they do Doppler ultrasound, not to be too cynical, but basically in a hospital clinical setting, usually they're looking, are you 70% blocked? And if you are, hooray, you qualify for surgery that has a chance of giving you a stroke. I mean, so you know, again, I apologize for being a little cynical there, but that is how our health system works. We're looking for tests that justify surgery that your insurance will pay for. I use ultrasound differently. Instead of doing Doppler, measuring flow and to see if you're blocked enough to qualify for a procedure, I want to see how old are your arteries. I'm doing a technique called carotid intimal media thickness. How thick is the lining of your artery? Basically, how thick is it determines how old your arteries are, and the thicker it is, the older they are. So I'm looking at using it over time yearly, and it tells us initially, how old are your arteries when you start? Well, if you're 10 years younger, that's great, but if you're 10 years older or 20 years older, you're in deep trouble, and it's really a helpful test to know. And what's beautiful about it, in contrast to like a chest CT where they do CT scanning, which causes radiation and slightly increases your cancer risk, there is no radiation with ultrasound. And it's very precise. We can use it yearly and measure, is your plaque shrinking, growing, or staying the same? And my average patient, turns out they're shrinking plaque. We have hundreds of patients who've shrunk their artery plaque by more than 10%, making their arteries more than 10 years younger. So that's like my favorite tool for a measurement is carotid intima media thickness, carotid IMT, ultrasound, no radiation, fairly low cost, at least as a one-time measure. And since it's measuring the age of your arteries, usually insurance doesn't cover it. Insurance is looking for a disease they can treat. This is the age of your artery is not a disease. So the only unfortunate thing is typically it's not covered by insurance.
So what method would you use when someone does, they say, show you the arteries are thickening and you do have some blockage in there, what would you recommend? What treatments that can actually?
The right food, the right nutrients, activity, and stress management.
Okay.
And with those four things, whether you use medication or not, we've shown that hundreds of patients have been able to shrink their plaque. And we've done this in our clinic with thousands.
Okay, well, let's talk about the right food then. Talk about some of the best foods.
So the best foods are really in groups like fiber, smart fat, clean protein, beneficial beverages, and flavors. Let me kind of dive into those. So fibers like vegetable, fruit, beans, and nuts. That should be most of what we eat. I don't want people getting their fiber from breakfast cereal or bread, because when you take a grain and you grind it into flour, it acts just like sugar. And as I said, sugar is the #1 cause for heart disease. And the last thing we want is for people to eat more sugar. And flour is basically sugar. So vegetable, fruit, beans, and nuts, lots of color, lots of flavor, locally grown, fresh. I mean, those are the best. You know, it's like a Mediterranean diet, and just follow it. The smart fats are things like olive oil and nuts and avocado. I mean, the two oils I cook the most with are avocado oil because it takes really high heat, and extra virgin olive oil, like for salad dressings and to drizzle on food once I've turned the heat down to minimal, like simmer. And, you know, those are wonderful fats. Or dark chocolate's a healthy fat. And, you know, salmon and sardines, you know, those seafood sources provide really healthy fat. So fiber, healthy fat. When I say clean protein, I mean clean. I mean, most protein Americans eat today, and Canadians and people in Australia, I mean, it's adulterated. You know, it's animal protein that comes from a feedlot, you know, with all sorts of chemicals and additives and toxins and in it. So we're talking, if you're eating, you know, eggs should be back on the menu, but you're talking organically raised, pasture raised chickens that lay eggs, or If you eat seafood, it should be wild, not fed in a pen. If you eat, poultry, again, it should be, cage-free wild. I mean, that's clean protein that doesn't come from a feedlot. And I think that's really important. And the last two, beverages, there are several beverages that are good for your heart, like cocoa or herbal tea, like green tea and herbal tea and green tea, and red wine. We're talking one or not more than 1 or 2 servings a day, and water, pure, clean water. I mean, that's what we should be drinking. The last thing we want to drink is sugar enhanced water or sweeteners. I mean, sweeteners are really toxic, and I don't think people realize how bad it is to be using, these chemicals that act like sugar in our palate, but don't provide calories. Most of them, of the chemical ones, are really bad. And the last category was taste. That means spices and herbs. They're very anti-inflammatory, and they really provide nutrients that we need. That's why our food tastes good, because we're biochemically attracted to things like rosemary and Italian herbs and garlic and ginger. I mean, those are fabulous for us, and we really want more of them.
Well, so well said. That's so good. That was perfect. Okay, so what about a couple of things on stress reduction?
So my favorite tools for stress reduction are one, activity. Go out for a walk, be with nature, get a workout, get a sweat up. It's really comforting. It breaks, we don't just break a sweat, we calm and relax. 2 is probably a good night's sleep, which I think way too many people do not get adequate sleep or good quality sleep anymore. It's disrupted by blue screens and blue light and noise and there's so, and lack of activity. And then I really like heart math, some form of meditation, of relaxation that we do on a regular, proactive basis, not waiting till we're frazzled to try to manage our stress, but proactively, get sleep, get a workout, and love and consideration and being kind to other people. It goes along, sharing hugs and warm smiles. And, those are the essentials to stress management that I think we need to practice proactively on a daily basis.
Again, I totally agree. So good. And so what about exercise?
Well, that's probably the most powerful predictor from our studies. So we've, in looking at thousands of patients, we've seen that the fitter you are, both aerobically fit in terms of strength, muscle mass, both of them predict if you're growing plaque or not, and whether you have a heart attack or not, and whether your blood sugar is controlled or not. It's also a really good predictor of cognitive function, brain function, and preventing memory loss. If you want to control blood sugar, activity is probably the most, right up, it's as important as food to be active to keep your blood sugar controlled. So all the risk factors for heart disease get better with activity. And it's just absolutely essential. So we want a mixture of aerobic, getting your heart rate up, and strength training. And what really cool from our research was it doesn't really matter how many minutes you spend a week. The bottom line is how fit you are. So, some good strength training and some burst activities, high intensity, short, activities really go a long ways to improving fitness. So it doesn't have to take as long as we used to think.
Yeah, that's so good. I totally agree. And I'm glad you said that. I just want to mention, the latest studies, in exercise physiology, people think that they need to go out and run and jog for miles and hours and all that. And I've always said that, if you think about it, our heart is the most endurance muscle in our body, right? Our heart will,
Right.
If you live to be 80, your heart's probably going to beat like, I think it's 4 to 5 billion times without stopping. So we don't need to train our heart for endurance. We need to train our heart to resist stress. That's why, like a short bout of higher intensity exercise is really a lot better for your heart. Would you agree with that?
I think it's more efficient. It's definitely more efficient. You can get more benefit in less time with high efficiency exercise. Honestly, if you like to go out for long runs, I think it's really good for your heart. So I'm not against these long workouts. I'm just trying to be realistic and practical and what can people actually do on a regular basis. So the most important thing is to be fit. both aerobically and from a strength perspective. Those are essential features of heart health and brain health and weight control. However you want to do it, I think is up to you. I think high intensity is like optimal way of getting fit. And it also takes about the least amount of time.
Yeah, absolutely. Well, I think we probably already talked all about it, but tell us just a little bit again about your 30-day heart tune-up. I know you have a new edition of your book coming out, right? Of your course.
I do. And so, and so yes, we talk about the right foods, the foods to avoid like bad fats and sugar, exercise in a lot of detail to give people the details and answers on how can they really improve their fitness, what makes a difference, how to manage your stress, but on the nutrients you need also. And one of the really cool things that we've realized in the last few years is one of the important nutrients that really benefits your heart. So we looked at research from our clinic and we actually looked at, okay, does salt impact your heart or did fat impact your heart? And we didn't see that much relation. What did make a big difference was magnesium. Mm-hmm. That was important. Vitamin K, fish oil, zinc, and fiber that affects your blood sugar, and omega-3, the omega-3 fats, like, as I said, fish oil. But the other one that's really showing up in large ways is probiotics, the bacteria that impact our gut. And it's been actually pretty amazing to see in almost 9,000 articles published in the last several years on how probiotics impact our health. And we've known it impacts your weight and your blood sugar and your cholesterol. And now we're realizing the bacteria in your gut determine whether you make a compound, TMAO, trimethylamine oxide, that can actually cause heart attacks and plaque formation. And the right bacteria help prevent that and help prevent plaque growth. So, one focus of the new edition of this new book coming out has to do with that. So my key points are like a Mediterranean diet, is what we should follow. Be active, manage your stress, and meet your nutrient needs. And one of those surprise new nutrients are the gut probiotic microbes that are so important for us. So that's really the essence of the program and what people can do to help prevent and even reverse heart disease.
That's so good. Again, I just wanted to add, one of our other experts have done research, and their research shows that coenzyme Q10 is actually one of the very best for naturally lowering blood pressure. So I think coenzyme Q10 is really good for your heart as well.
Yeah, CoQ10 has been shown. We were not able to look at CoQ10 levels and how it correlated with plaque formation, but yes, there is data out there that it will lower blood pressure. But CoQ10 really varies with its absorption. Mm-hmm. The type of CoQ10 it's really important. You're not just looking at like the crystal powder CoQ10. I think you only absorb 2 to 4% of that. It's really pretty poor to get into your bloodstream. The oil-based is better, but the micellized CoQ10, where it's actually like within these little tiny fat bubbles, has 8 times better absorption. So think about it. Even if it was twice the cost, if it has 8 times the absorption, it's 4 times cheaper than taking the cheapest form of CoQ10 with the goal of getting into your bloodstream.
Right. Well, okay, so the last thing here, I was going to ask you, to kind of sum it up, like, I think we already have, but let's go ahead and sum it up again. What would you say the top 3 to 5 things people should be doing right now to not only prevent heart disease, but, to also build a healthy heart?
Well, it's really to take action today. I think the tragedy here is people are waiting for a sign to take action, right? I mean, that's kind of common. But when you take steps that improve your heart, you improve your circulation, that improves your energy, how you feel, your sexual function. All of those things improve dramatically when you take steps to protect your heart. So don't wait until you're either dead or you've had a heart attack, because those are the 2 most common signs. The first signs of heart disease are death and heart attack. So Don't wait for that. Take action that'll improve your circulation, improve your quality of life. So add those foods, those special foods, fiber, fruit, vegetable, beans, and nuts, smart fats, clean protein, flavor from spices and herbs. Meet your key nutrient needs, the ones I talked about. And, manage your stress and be active and fit. You feel so much better. The quality of your life goes up dramatically, and you help to prevent the most common cause of death today for men and women. So I think, the steps that you can do are easy to follow. And, the Mediterranean diet's the easiest diet on the planet to take seriously and get and use. So it's easy. It can be fun. Your food tastes fantastic.
It's good, yeah.
And you feel better.
Yeah, that's so good. So good, Dr. Masley. Again, it's the old thing of the old saying of a pound of prevention is worth a pound of cure. In this case, it's worth your life, right?
Yeah.
It's worth more than a pound. It's worth your life. So, again, I want to remind you that along with this video training, which you've got some really great information and what you need to do to get started, be sure and check out the PDF that comes along with it, where you'll get all of Dr. Masley's information. Go to his website and check out his new books, and he's got lots of trainings there and things that can be really helpful. So you want to stay connected and learn more. And again, so I think the only last thing to say again is, I think Dr. Massey will agree with me that, knowledge without action is useless. So you've got to step up and start taking action on these recommendations that all of our experts have offered to us. So Dr. Massey, that was just so good. I really appreciate that. That was just really the best, wonderful information that can really help a lot of people. Thank you so much.
Thank you.
Thank you. And thank you all for being here. And again, come on now, you got to step up and start taking action. And I promise you, when you follow the recommendations of all of our experts, I promise you, you're going to greatly improve your overall health and well-being, and you're going to be able to live longer and enjoy your life a lot more. And that's what this program is all about. So thanks very much for watching.